Dr. Philippa Whitlam.
Thank you very much, Mr. Speaker. I would echo our good wishes to the member for Mid Bedfordshire. I welcome the declaration to keep Parliament open, but surely we should be looking at core functions. We should be looking at who comes into the House, what we do in the House. And I have to say I was a bit disappointed to have several hundred of us jammed into voting lobbies on Tuesday. This is just not a good idea. So there are ways of how we work that would still allow Parliament to stay open. With cases having increased by 13 times outside China in just 2 weeks, it has, of course, been declared by the WHO as a pandemic. But they do describe being concerned at levels of inaction. They call for quicker and wider testing so that milder cases are diagnosed quickly, isolated and the spread reduced. Obviously, we've seen the speed of change in northern Italy over a matter of a couple of weeks. So should we not be thinking about the delay phase? Containment and delay are a continuum. It's not a switch between one and the other. And to see leisure events, large leisure events, still continuing, they are not critical. So should we be decreasing those? Do we know yet whether children are spreaders? We know they don't catch it, but do they spread it? Because that would be central to any decision about closing schools. And obviously closing schools would have an impact on NHS and social care staff. I welcome the announcement in the budget about funding to support people on sick pay, but I wonder if the Secretary of State could clarify whether this will be provided to people who do not have sick pay in their contract, because that's exactly who we were concerned about when we raised this. How quickly will all three devolved governments hear about the extra funding they're going to get, because it's urgent for them to take action as well? There has been talk about bringing doctors back from retirement. So is there discussion with the General Medical Council about relicensing doctors? Is there discussion about providing Crown indemnity for doctors who have maybe retired within the last year or 2 years? The UK is now already outside the European Centre for Disease Control. So will the government now at least rethink leaving the pandemic early warning and response system?
Thank you very much. The Honourable Lady asked some important questions about how Parliament will function. Matters for how we work are, of course, for Parliament, for the Leader of the House, the Speaker, the Commission, all guided by the science, and they are in constant contact with Public Health England to get the very best advice. Of course, when we're voting, if we are not symptomatic, if we don't have symptoms, then this disease passes in the very, very large part from people who have symptoms. So what really matters is making sure that as soon as people have symptoms, potentially of coronavirus, they get in contact with 111 with Public Health England. She asked for more testing. We are absolutely ramping up the testing capabilities and have been commended for the approach that we're taking by international bodies. She mentioned the WHO. She asked about children. The good news, one of the good pieces of news about this virus is it does appear to have a much, much less significant impact on children. She asked about the GMC and indemnity. Absolutely, both of those issues will be addressed in the bill. And we're working very closely with the GMC. And she also asked about collaboration and work with the European Union. We still remain in the European Union data transfer capabilities, although most of this data is being transferred, frankly, is being published. We're being as transparent as possible. This week we brought out a new website to be transparent as possible about all the cases in the UK, and most European nations are taking exactly that approach.